Did you see that Emma Jane eat? That woman must weigh 275 pounds. She never stopped shoving it in.
It's not good to make fun of people because of their weight. It doesn't help them lose weight, it just makes them feel bad.
She had to talk the entire time. She just sprayed food out all over the table. She could have put my eye out.
But I do think it's okay to make fun of people who spray out their food while they talk.
What's the matter? Why are you rubbing your chest?
I got a bubble.
What do you mean you have a bubble? What is it? Is it pain?
If it was pain, I'd call it pain. I have a bubble.
I always ask patients about chest pain when I examine them, but heart attacks can present with a variety of symptoms, especially in women. Pressure is typically what I think about for a heart attack, but many women will have heart attacks and not have chest pressure. Some of them will have back pain, some of them have just sort of nausea or jaw pain or arm pain. Of course, that can happen in anyone, but women are the ones who typically have these atypical symptoms.
A bubble is something that just sits there and presses until it's chased away by a big belch.
Yeah, it can be a sign of indigestion, but chest pressure is kind of non-specific, and if an older person is having chest pressure or some sort of bubble that won't go away, I would typically tell them to go to the emergency room and get checked out.
I don't need a doctor.
Listen.
I hate doctors.
Me too. Except my boyfriend. He's a great doctor, if you know what I mean.
Oh,
What, Ma? What?
pain.
What kind of pain?
The kind that hurts.
Like
When I ask you to describe your pain, what I'm actually looking for is the detailed description of the pain. In medical school, I learned old carts. I think the most important are probably location and severity. Like, you know, if you have pain in your foot, I'm not going to expect that you're having a heart attack. But ultimately, all of those descriptors of pain can be very helpful when I'm trying to figure out what's going on with you.
My mother wanted him to do her hysterectomy, but he wouldn't.
But he was willing to do her lobotomy.
A lobotomy is a medical procedure that we don't do anymore in medicine. Essentially, the connection from the frontal lobe to other parts of the brain was severed. It was thought to be an effective cure for schizophrenia originally. However, it had a lot of side effects. Some people who got lobotomies became incredibly anxious. Some of them developed incontinence and stupor and confusion. Some people had seizures too. That's no good.
Why do you think you're having a heart attack?
I'm 80 years old. I got Pavarotti sitting on my chest. Odds are it's a heart attack.
The most common description that I've received from patients who are actually having a heart attack is the feeling of pressure, of an elephant sitting on your chest. So Sophia's depiction of her pain is pretty concerning, and she should go to the emergency room immediately.
The doctor was out, but they're trying to locate him, so I called the paramedics, and they're on the way.
Oh, great, great.
Dorothy, do we have heart disease in our family?
Having heart disease in your family matters a lot when you're younger, because you're more likely to have a heart attack at a younger age. However, older people, regardless of their history of heart disease, are almost always at risk. So chest pain has to be taken seriously, and family history cannot help you rule it out in someone who's 80.
Didn't Aunt Teresa have a heart attack?
Aunt Teresa didn't have a heart.
The burns, man, the burns. If you're enjoying this reaction, please like this video, subscribe to my channel, and hit the notification bell so you don't miss a single upload.
You know, I'll probably see your father in heaven. I haven't seen him in 30 years. I wish there was time to get my hair done.
One of the things that I love about this show is that it doesn't assume that older people lose interest in sex, in looking good, in living their best lives. I love it.
My grandparents lived to their 90s. One was 102.
In Minnesota.
So?
Do you know how they freeze dead people to preserve them and then bring them back? That's like living in Minnesota.
I'm not the hugest fan of the Midwest, but Minnesota's actually quite a happening town. Did I just say town? I just called Minnesota a town.
The cold slows down the aging process.
So that's not really a thing. That being said, we do cool people if they've had a cardiac arrest, and that helps with neurological recovery, so that's kind of cool.
Do you want to be buried or cremated?
Burial, I guess. But will you promise to put a blanket in with me?
Why?
Well, I just feel more comfortable and cozier. And I'd want my pictures of Charlie and the animals.
Seems like Rose takes the ancient Egyptian approach to burial. You want to be buried with everything that you'd need to live on in the afterlife forever. That's kind of cute.
I want a fancy funeral and then be buried in Arlington Cemetery.
Why Arlington Cemetery?
Because it's full of men.
I love that even in death, Blanche is going to be a Blanche.
Dorothy, she'll be fine. I'm sure it isn't a heart attack. A heart attack's bigger.
Heart attacks can be really subtle and small. This is actually a very typical presentation for a heart attack.
He died while you were making love?
Well, he didn't die then. He had his heart attack. I grabbed a pair of white pants, and I was putting them on him, and Charlie said it was after Labor Day, and he couldn't wear white.
Is that really what you think about in the middle of a heart attack?
In the middle of a heart attack?
I'm glad to see that Dorothy agrees with me.
It's going to be a while. There's lots of trees down and accidents because of the storm, so the paramedics can't get through right away.
We can drive her to the hospital.
That's
No,
right.
but wait a minute. The hospital's 20 minutes from here. If the paramedics can't get through, what makes you think we can?
That actually is a really good point. This is hashtag not medical advice, but sometimes it is better to drive your friend to the hospital than to get an ambulance. The only exception to that is if the hospital is far away, because if your friend is having an emergency and they need some sort of immediate intervention, like a breathing tube or CPR, you do not want to have them in the car and have to do those interventions while you're taking them to the emergency room.
Is there anything else we can get you, Sophia? A little tea, perhaps?
If someone is having a heart attack, don't give them any food or drink. They may require a surgery or procedure and need anesthesia, and you don't want to eat anything before you get anesthesia.
So what's this, Sophia? I hear we're not feeling well.
What are you, a partner? What did you eat?
Kreplach.
You're Jewish?
Who ever heard of a Jewish doctor?
How come so many doctors are Jewish?
Because their mothers are.
That's the best answer I've ever heard.
Whoa, 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 whoa.
Ooh. All right, so he pressed on the right upper part of Sophia's abdomen and she screamed. So I'm going to assume that she either has cholecystitis, which is an infection of the gallbladder, or she has appendicitis. Appendicitis normally presents with pain in the right lower part of the abdomen, but it can actually present with pain in many different places. That pain can migrate. But this does look like a gallbladder issue based on the location in the right upper quadrant of the abdomen.
It's most likely a gallbladder attack brought on by overeating.
She didn't have a heart attack. You're absolutely sure.
I've got a portable EKG machine in the car. I'll double check, of course. But it doesn't seem like a heart attack. She's got classic gallbladder symptoms.
So an EKG will measure the electrical rhythms of the heart, and it can give a clue if you're having a heart attack, but you really need to get some lab work done. The EKG is not really enough, considering that Sophia had chest pain and is an older woman.
Tenderness in the upper right quadrant, a slight discoloration of the whites of her eyes.
Jaundice and scleral icterus, which are discoloration of the skin and the eyes, respectively, those can occur during a gallbladder attack, or it sounds like he's describing cholelithiasis, where there's a gallstone in the gallbladder tract if it's obstructing. However, you usually don't see it in those situations unless you've had obstruction for a while. That yellowing of the skin is caused by bilirubin. That's the pigment that is created when blood breaks down. But it takes a while for that to build up. This kind of acute attack usually wouldn't cause jaundice, so that's not quite accurate.
EKG machine.
Come here, sweetie.
Right back.
Well, I'll call the paramedics and tell them not to come.
No. The paramedics still should come. She should go to the hospital.
See you in Guatemala.
The other cat came to say hi.
Here, honey, dig in.
Of course, it'll be just my luck. I'll eat, I'll gain 40 pounds, and live to be 90.
So older people who are in the overweight range often do live a little bit longer than their skinny counterparts. Having a little bit of reserve can be helpful. There was some mediocre medicine in that episode. The doctor made the assumption that she's having a gallbladder attack even though she had chest pain. So for that reason, this episode of Golden Girls gets a B for medical accuracy. Thanks for watching, and I'll see you in the next one. Bye-bye. You have a Jewish doctor? Whoever heard of a Jewish doctor?